Hi, everyone. It is Anna here from Little Wings Sleep, and I am very excited to have one of the favorite people that I actually creep and stalk on social media. You know how you have, like, it says you follow like 600 people, and then you genuinely follow someone because you actually care about what they're doing? I have Dr. Stephanie Liu here from, you're in Alberta, right?
I am in Alberta. I'm so happy to
Yeah,
be
so
here with you.
welcome here.
Thank you.
So, Stephanie, do you want to tell us a bit about yourself, what you're doing, and we'll go from there because we're going to dive into all things baby, mama, all of that kind of thing, and what you're doing with moms.
I love it. 3 years ago, I started my passion project, Life of Dr. Mom, where I just want to give evidence-based, credible, relatable information about parenting, kids, women's health, to everyone. And then since then, my next project that I started was a company called By Dr. Mom, products that are designed by physicians for babies and kids.
Like, and this stuff works, guys. Like, I've had clients, like, it, like, it's not just, she's not just selling you something, this actually works. So, how did this passion kind of come around? Was there a moment for you that you were like, I know you've told me a little bit about your story of like you couldn't work in the US while your husband was doing some surgical training. Was there like an aha moment for you when you had your kids where you felt like you needed to know more? Or what were like kind of those, what was your journey into this kind of part of the world niche?
Yeah, I'm a family doctor, by family physician and a prof at the University of Alberta. And I remember, like, when you say the aha moment, I remember what it was. My daughter was, I think, but almost a year old, and I was like, this is really hard. I love her more than anything that I could ever imagine, but there's so many things that, despite being a healthcare provider, that I had no idea. Sleep training, am I feeding my daughter right? Breastfeeding was freaking hard. Like, all of these things I didn't know, and my medical training didn't prepare me for it. And I said, you know what, if I feel this way, there's probably a lot of other people that feel this way. So I started spending more time doing research, something called evidence-based research. So that's uh, sci this is information that's collected by, like, reviewing scientific journals. So I did that and I
Mhm.
compiled it. One of the first questions I asked was, is sleep training safe? Because I remember I struggled so much with my daughter with getting her in a good sleep routine. So that was one of the first questions I did. And I spent all this time making this research, and I said, you know what? I want to be able to share this information because it took me so much time to do it. And I
So
think
much hard work.
well, yeah. So then it started with that, and then it just kind of grew, and it happened organically. And the most exciting things was when I got my first message. At this point, I had, like, I think 100 followers, and someone said, "Hey, Dr. Liu, thanks for writing that post. I found it really helpful." And that was when I
Mhm.
said, I want to keep going with it.
Yeah, because it makes a massive difference in those moms' lives. When there's so many voices out there when it comes to like when you have a baby and you're like, what is true and what is not? Like I got a DM last night of just like a mom being like, thank you for making me feel like this journey is not lonely, right?
Yeah.
Like it can be lonely.
And that's what I love about the community, just this supportive environment where, people can help each other, support each other. And I've learned a lot from people that have followed me too. They've given me tips about things that I would never know. Like, I want to get my daughter in the kitchen, but I don't know what knives to get. And they're like, oh, check out this. And I've learned so many things along the way from just having this community.
Yeah. And community is really it. And this is where like online community is kind of it's happening, especially in the pandemic, right? Like it's a way we can connect with other people in the same phase of life. So when you think back to like that year and like even though you're like a family doctor and then you're feeling so lost and like all of these questions, what were like the three biggest things that you wished you had known? Like if you could tell a mom, like these are the things you need to know, what would they be?
Yeah. The first thing, and I kind of touched on this, and this is one of the inspirations for my blog, was the breastfeeding is hard. I thought I'd be so good at it. And, I feel like such a jerk because so much of my practice before I had my kids, I'd be talking, oh, did you know that breastfeeding helps reduce acute media? Like all these health benefits about breastfeeding. And I never even realized that, what if this mom can't breastfeed? Or what if she feels like poo that she's not breastfeeding her child? And so that's the first thing. If you're struggling with breastfeeding, ask for supports, ask for help. But if you ultimately can't breastfeed, then that's okay too. You're doing an
And
amazing job.
absolutely. I mean, my journey was far from easy when it came to breastfeeding, and I learned a lot through it. And you know what? Even on the mental health side, sometimes for moms, like I've had clients where it's like that, like I've chosen not to breastfeed for my mental health. Like
Yeah.
the hormones, like the oxytocin and the crash was just like too hard.
Yeah.
Yeah.
Um, the second thing is, parenting is wonderful in so many ways, but it's freaking tiring too. And I remember me and my husband talked about this. My husband's in healthcare too, and we both have been on call like over the years. And in the first years of my practice, I was on call, weeks at a time. And I remember being tired then. And my husband says too, he's a surgeon and he operates overnight sometimes. And he's like, I remember being tired, but to this level, we've never been this tired. The first few months of parenthood were hard and we were exhausted. And I think that parents need to know that it's probably going to be a little bit harder than you expect and that you're doing a really good job.
Yeah.
Um, and then the last thing I learned was getting your kids to sleep is not as intuitive as you thought. I honestly thought, with babies, you put them in the crib and then you just walk away. I know for some babies it happens that way, but for many, many families it doesn't. And sleep is really important. And sleeping is not intuitive.
No, you know what? 70% of kids need help in directing their sleep because the majority of sleep is behavior. It's not like babies aren't going to be like, just sleep when they're going to sleep. They won't.
Yeah,
They don't know what tired feels like. Like this is a new feeling for them. And
absolutely.
so we have to facilitate that and teach that. I love those points. And there's just so much grace that we have to have with ourselves as new parents. And I found even as a second time mom, I almost needed like more grace for myself because it was like there was a little person pointing out how much there was to still do. But
I hear you. I hear you.
yeah. So, do you mind if I ask you like some of the common things that I get asked a lot? I mean, I'm not a doctor, so do you mind if I ask you some of the common things that we get asked um, that I know moms and dads or caregivers are curious to know?
Absolutely.
Okay, so one of the biggest things that parents like will often struggle with is colic and reflux. And I know it can be a really big deal. What are the signs that you're looking for as a doctor, or as you're like going, these are helpful tips, or like when you hear colic and reflux, what comes to mind for a little babe?
Yeah, awesome question. So, like, the first thing I get asked this a lot in clinic is like, how do I know if it's just like normal reflux or something I should be worried about? And so that's actually what I think about in my head is when I see a baby, I try to figure out, is this just reflux? Like the medical term is gastroesophageal reflux, or is this gastroesophageal reflux disease? And the gastroesophageal reflux disease, also known as GERD, is something that needs to be assessed by a physician and needs some investigation. So gastroesophageal reflux, so normal baby reflux, a lot of babies just spit up. And that's because there's a sphincter from our esophagus, the tube that goes down into our tummy, and that sphincter is just developing in babies. And a lot of times food from our tummy goes up and comes out through that esophagus and out. So lots of babies will do this. And in general, it's normal if the baby is growing well and the baby is happy. And so we call those babies happy spitters, and that's a normal situation.
Right.
Gastroesophageal reflux disease is when a baby is spitting up, seems very irritable, and they're not growing well.
Hmm. Right. And that's when that kind of like red bell goes off for you, and you're like, I need to look into this more.
Exactly. And one of the best things that, why I recommend checking in with your doctor and going for those regular physicals for your baby is because one of the things that we monitor is the baby's weight. And we want to
Mm-hmm.
make sure that they're growing appropriately because that'll kind of help us figure out if this is something that, it's going to resolve. We know that reflux, as a baby gets older and as that sphincter develops, the reflux is going to resolve itself. Or is this something where we need to kind of do more intervention and try to investigate more?
Yeah, I mean, that's even something we consider with sleep, right? Is we'll graph them from birth weight to current weight to see if they're on their growth curve, right? Because hungry babies won't sleep. That's just a
Absolutely.
fact.
That's a great point. Yes.
Yeah. And what about colic? Like, because a lot of parents, I think they're kind of hand in hand, right? Like they kind of feel like, is it colic? Is it reflux? What's going on? I really don't know.
Yeah, so colic, the way I explain colic is I think of the number 3 a lot. So colic is the definition medically is, you're crying for more, the baby's crying for more than 3 hours, 3 times a week, and they're under 3 months of age. So colic is a well baby where they're crying for no real reason. The
Hmm.
reason that a lot of people think that colic and reflux are associated is, even though with colic we don't really know what the cause is, there's some thought that maybe it has to do with some digestive stuff. So
Right.
my approach to managing colic and reflux early on is kind of the same stuff. So the first thing after you feed the baby, keeping them upright after feeds. When you're feeding them, if you're bottle feeding, adjusting the angle at which you feed the baby.
Yeah.
Another thing that some babies can get quite irritated and can increase reflux is if you're overfeeding the baby.
Right. Like we have to it's before 3 months that they don't actually know if they're full or not. Like they're learning that feeling of what full feels like. And so they'll keep taking it.
Yeah, exactly. And then some other things that I actually posted about yesterday. In general, if for colic, what I try to do first is just general soothing tips. So if the baby seems a little bit fussy,
Mhm.
giving them a pacifier, seeing if that helps. Breastfeeding is also can be quite a soothing thing to do. Massaging their tummy has been helpful. Even just simple
Yeah.
things like going for a walk, change of scenery helps.
Mhm.
A warm,
Mhm.
soothing baths are also helpful too.
Yes, absolutely. I find with babies that we work with, and if they have reflux or something like that, we want to get that sorted by their general physician first before we work on any sleep related things. But often colic is reduced by making sure that your baby is overtired. Do you find that there's a correlation in your practice? Like these babies, like my baby won't sleep, but it's crying a lot.
Yeah, so your point on the overtired thing, that's another take-home message that me and my husband learned. We didn't realize that sometimes babies don't sleep when they're overtired. So one of the
Hmm.
things that me and my husband did, which is so bonkers now looking back, is we thought to ourselves, we said, you know what, if we keep, and this is our first child, Maddie, we thought if we keep Maddie up later and then put her to sleep, she's gonna be exhausted and go to sleep. It totally didn't happen that way. She was overtired, overstimulated, and wouldn't sleep.
Absolutely, because then she's got this cortisol running through her body, which is a fight, flight, or
Mhm.
freeze hormone, and it makes things so much harder because then you can't calm your body, which I know I get super emotional when I can't calm my body. So,
Me too, me too. Yeah,
yeah, and, I have regulation skills, newborns, we've gotta teach them those skills.
yeah, yeah.
Yeah, it changes things significantly. So another question that we get a lot is, how do you know, how often should you be weighing your baby? Because, I have had parents who are like, I weigh my baby every day or every feed, and then I have other parents who are like, I never weighed my baby. I had no idea.
Yeah, so, I for my kids, I didn't weigh them. What I recommend though is those frequent touch points with your healthcare provider. So what I recommend is, at birth the baby's weighed, and then the most very important visit is the 2-week visit. So you bring
Okay.
your baby into the doctor's office, whether it's family doctor or pediatrician, and the 2-week visit is super important because at 2 weeks we want to make sure that the baby weighs at least what they did when they were born.
Yes.
Yeah.
Yeah.
And then after that, your doctor, your care provider will decide how frequently after that. For me, for babies that are growing well, I normally do one at birth, 2 weeks, 1 month, 3 months, 6 months, 9 months, and then 12
Yeah.
months.
Awesome. Yeah, because I think that otherwise their weight can fluctuate day to day, right? Like
Exactly.
between poops and feeds and growth
Yes.
spurts and everything.
Yeah,
It's
definitely.
quite amazing, these little people, how complex they are and how they change our lives.
Oh, totally. I remember the first time I held my daughter, overwhelming love, but I remember being so scared of just, like, dropping her. She felt so small and so, like, fragile. And yeah, it was
Yeah.
just like this little bundle of, like, you don't know what to do, lots of love, lots of fears, lots of all of those emotions.
Yeah, yeah. On that point, like when you see a parent and a baby coming into your practice, I know that like postpartum anxiety and depression have been a really big thing. We've seen numbers really increase over the pandemic. Are you noticing that too in your practice?
I am. And one of the most heartbreaking things with the pandemic is how isolating it is. Isolating for the elderly, isolating for new parents. It's been really hard for some of the families that I followed my practice. Also, obviously, very difficult for some of the frail elderly too. It's been hard on everyone. But yes, I have definitely seen increased rates of anxiety and depression too during this pandemic.
Yeah, and I think it's something that's important for parents to note, like, that those times when your baby um, is finding it really hard to settle, that anxiety can really increase. Like it makes it really hard, and without the usual support systems, or like how you imagined motherhood would go.
Yeah.
You know, it changes things quite significantly.
It does, and that's one thing that I think has made me a lot happier as a parent is I don't even know if that's the right thing to say, but I've really lowered my expectations of myself, and that's
I
helped me
love
a
it.
lot. I had these expectations where, I wouldn't be letting my kids watch screen time. I'd be doing meaningful crafts with them all the time. I would be, getting home, making these first class meals, all this stuff. And then when I put all that pressure on myself and I wasn't meeting it, I was like, I suck. But then now I look
Mm.
at it, I'm like, you know what? They're happy kids. It's nice that we have movie nights a little more often during this pandemic. And what's so bad about having takeout once in a while? If I'm feeling a
Yeah.
little run down and it's like that, those expectations, once I lowered them for myself, I felt a lot better.
It's like we try and make everything absolutely incredibly memorable for our kids, and we feel like garbage because we're exhausted doing it.
Definitely. Yeah,
And
so
then, like, yeah. And, I put in a lot of effort for my 3-year-old, a couple of months ago, and I, like, went to all of these extremes to make something very special for her, and then the other day, my husband says to her, "Hey, do you remember that?" And she's like, "No. Did that happen?" And you're like, "Oh, okay. Yeah, let's just bring that down a notch."
That's so funny.
Um, okay, so another thing that lights up mom groups like nothing else, and this is like really, I know something you're passionate about, is like rashes and eczema. Like the amount of photos I've been sent of different rashes from different parents, and I'm not even a doctor, so like it is like, when your baby has a rash, like I remember ringing my midwife and being like, there's like spots on her back. Here's a photo. And she was like, it's called heat rash. I was like, do I need to get a special cream for that? Like, where do I send my husband? So, like, for you, like, eczema is like one of my kids has eczema and it's a massive deal. Like, it can be really, really tough. And I've got lots of clients with it. What are the key indicators of eczema versus like a rash that you like need to go and see a doctor? And like, I want to hear more about what you're doing with eczema.
Okay, you know what? You are right. Baby skin is my passion. And that's because, a lot of rashes can be avoided in the first place with just kind of proper skincare. So for babies in
Okay.
general, less is more. And it sounds kind of silly, but really less is more. So one of the first things I recommend is to avoid things that can irritate the baby's skin. And one of the things that I even did with my kids because I love smells. I'm really into scents is I use those like fancy scented baby creams. And right away, my daughter broke out with a rash. And that's because scents are very irritating for the skin.
Mm.
Okay. Especially for little newborn developing skin, we should avoid products with scents. The other
Okay.
thing is babies can easily, their skin is just developing, so their skin can easily get quite dry. So one of the first things that I recommend is, whenever you're bathing your child, after you take your baby out of the bath, don't ever rub the skin. That can be irritating for the skin too. Pat it dry. Patting dry the
Mm.
skin will leave a thin layer of moisture, and then right after that, apply a moisturizing cream that's unscented. The next
Yes.
thing that I recommend is really limiting the use of soaps. Babies, I joke about it, but they're kind of self-cleaning. Like they're not that stinky. Okay. The only
That
area,
kinda like linen, where
yeah,
you're like, "I'm gonna buy a linen shirt because it's self-cleaning."
yeah, exactly. And that baby smell? Like that's why I always joke with my husband. Like they're kind of self-cleaning. I love it. So if you are soaps are actually quite irritating and that can cause rashes. A lot of times the patients like this infants come in, they can get so it's something called a contact dermatitis, which is essentially just irritation from soaps. So if you are to use soaps, use it only in the soiled areas. So in the diaper area where there might be some residual poop, go ahead and use soaps, but just at the end of the bath. And then take the baby out right afterwards. So skincare, I mean, just the proper routine will help avoid a lot of the rashes right off the bat.
So then they're not, like, sitting in the soapy water, like, if you were to
Exactly.
do it at the beginning. Yeah, like,
Exactly.
yeah, that makes sense. I mean, baths on, like, my side of things, we love them because they lower the core body temperature, which induces sleep, right? It helps melatonin production.
Yeah.
However, it's not always great for skin, especially baby skin. And so often just like a warm wipe down can like really help like lower that core body temperature and then like give that same effect for sleep without like drying out the skin so much.
Yeah. Yeah. That's a
Yeah.
really good point. And like with the bath, the one that was kind of my inspiration for my product that we were talking about for eczema. And so what it is have you heard of oatmeal baths before?
Yes, and I'm gluten free, so we don't do them. My daughter's gluten free too, so that's been like a challenge. So I'm
Yeah.
curious to hear about them.
Yes. So oatmeal baths are actually one of the first things a lot of doctors, dermatologists will recommend for babies with eczema because oatmeal contains something called beta glucan. And in oatmeal, there's
Okay.
about 2 to 5%, 2 to 6% beta glucan. And my bath is developed off that premise. So we use University of
Okay.
Alberta technology and we're able to extract beta glucan to 23%. So I almost think about it as a supercharged oatmeal bath. But the thing that's really cool about it is it was extracted not using chemicals and solvents, but using air technology. So it's the purest, most natural form. And the reason I like that is we never encourage babies to drink food like bath water. They shouldn't. But the reason I like it that it's free of chemicals and solvents is if they do get some in their mouth, it's not really a big deal.
Yes.
And the beta glucan is it's actually trending in Asia, so that's actually how I kind of heard about it. Is beta glucan is used in Korea for like anti-aging, but there's multiple clinical studies that says that beta glucan helps with skin healing and hydration. And if
You're
you
like
study it,
blowing my mind right now.
it's so
Like
honestly
I'm
my
like,
mind was blown. I was
this
so
is
fired
like,
up and so excited. Yeah,
yeah, like why people recommend oat baths. I've always been like, well, why? Like I'm a why person. So this makes complete sense. But that this is insane that you're able to get it so high, like
yeah.
the percentage.
And one of the most exciting things was, some kids will need that steroid cream, right, to help kind of reduce the inflammation because eczema, I think of it as super inflamed skin. But one of the most exciting things was, one child that I saw in clinic had moderate to severe eczema. And I said, you know what, they're probably going to need a steroid cream, but let's try this bath first. And after 5 to 6 treatments, it pretty much resolved. Right. In addition to those kind of hygiene techniques that I recommended, limiting soaps, making sure to moisturize afterwards. And that was kind of one of the most thrilling things that's going to happen over the past few weeks for me.
And that's like where you feel like you're like, this is my life's work. Like this is exciting.
Oh,
I
unbelievable.
because like when kids have irritated skin, they are fussy as all get out. Like they are, I mean, I am too, right? If my skin's sore.
Me too. And another reason I created this bath was it's been is it cold where you are? No, but you're in BC.
Yeah.
It's been
Yeah.
insane in Alberta. And one
Oh
of the
yeah.
things that can cause, so even people without eczema, the dry, cold air can cause irritation of the skin. And so our bath also just works for that, for just dry, itchy skin.
Yeah, the client I was telling you about is in the Rocky Mountains,
Yeah.
and they moved there, and they were like, "This kid's never had eczema, and it's just, like, head to toe, and it's good."
Yeah. And it's those
Yeah.
shifts in temperature too. So when you go outside and it's really cold, and all of a sudden you come into like the kind of dry,
Mhm.
heated air, that's when it kind of is quite hard on the skin.
Okay, how would you help that? Like, would you just, like, slowly undress them rather than, like, or is it just one of those things that's, like, a really hard reality of life?
It's a hard reality of life. But
Okay.
the bath, if you like taking baths, the beta glucan bath, moisturizing regularly and being gentle on our skin. So one of the things that, and it's such a small change, but even for adults, after getting out of the bath, making sure that you just pat dry your skin instead of rubbing it. And keeping that
Mm.
thin layer of moisture on, and then locking it in with a cream, you'll notice a difference yourself.
Well, like, the skin is, like, our biggest organ of our body, right?
Yes.
Like,
Yeah,
and so it's really important we look after it and look after our kids as well.
absolutely.
So, that's wonderful. Where can we find this?
Yes. So, it's available on my website by drmom.com. And it's also available in multiple local stores in Edmonton, but also it's going clinic wide to Rejuvenation Dermatology, an excellent dermatology clinic that's in BC, Alberta, Ontario.
That is really exciting. Guys, I have been so excited to talk to Stephanie today because Stephanie, because she just like literally on her Instagram covers everything. So you need to make sure you head over there. And even my mom questions, I've scrolled and searched through her feed. So thank you so much for coming to share with us today. I really appreciate it. And so do you want to just like let people know? So lifeofdrmom.com.
Yes, lifeofdrmom.com is my website for information. And then my products, my books, and the beta glucan bath are on bydrmom.com.
Yes, because 'cause you've got your book, Maddie's Mom Comes Home. Is it Maddie's Mom Comes Home?
Maddie's mom goes to work.
Goes to work.
Yeah, kind of the same thing, but yeah, it's, all of my products, and I kinda mentioned this, were inspired by my own kids, and I've also worked with a lot of my physician colleagues to make, the best possible products, and it's things that I think I needed for my own family.
Mhm.
And that transition from my mat leave, going back to work, that during the pandemic when I was working from home and then all of a sudden had to go back into clinic, it was for those transitions in our life.
Oh, I love it. I love it. I love how you're just, like, bringing, like, real life in with, like, your skill set and your gifting, like, professionally. Like, you've got this, like, perfect marriage of the 2.
Oh,
I
thanks.
love it. So, thank you so much for joining us today, and make sure you go over and check out her Instagram and also her stuff. I will be ordering my own because now I really want to try it myself, even though I have clients who just like sing her praises. Thank you so much, and we'll be chatting to you soon. Bye, guys.
Bye.
Have people in your life been telling you, you'll never sleep again? Are you starting to stress about how life is going to change with a baby or adding an additional baby? I've been there. And mama, it's time to cheers your new best friend, Little Wink Sleep. Our Nurturing Newborns program gently and gradually lays the foundation for sleep in a way that you're able to manage and understand. We use a science-based approach that fosters healthy attachment. You'll be able to let go of the stress of newborn sleep and enjoy this stage, knowing your baby is set up with the right skills. Nurturing Newborn Sleep includes all our insider coaching strategies, taking you step by step, troubleshooting along the way, as well as